All right.
Welcome again, everyone, to our second Quality Improvement Learning Academy session. Next slide, please. So today we'll just go over some brief housekeeping and a short welcome. And then the bulk of today's session will be by Jane Taylor discussing grounding project purpose and data in equity. And then we will briefly go over our homework for this session and next steps. So now I'll hand it over to my colleague Lisa for housekeeping.
Thank you, Olivia. Hi, everyone. Again, my name is Lisa, and thank you for your attention as I review some housekeeping. First off, this session is being recorded and will be posted on the EPIC website for future viewing. All participants are muted upon entry, and we ask that you remain muted to limit background noise. We encourage the use of the chat box to ask questions or post comments. All questions will be captured from the chat box, and we'll address as many as we can. For audio, if you can hear me, you're likely connected correctly, but we'll do a quick review. After you join the meeting by clicking the meeting link, an audio box may appear. You can join by either computer audio or phone. To join by computer audio, click computer audio and you should be all set. To join by phone, dial the given number, enter the meeting ID and press pound. Then enter your given participant ID and press pound. You'll then be connected to this session's audio via phone. Lastly, to access the chat box, click on the chat button in the bottom of your Zoom screen. A sidebar will appear on the right. Type your questions or comments into the chat box and send them to everyone. Again, we encourage the use of the chat box for any questions or comments during this session. Thank you, and I will now turn it back to Olivia.
Thank you, Lisa. So welcome back, everyone, to the Healthy Start QI Learning Academy. Next slide, please. So first, we just wanted to get a sense of who is on the Zoom today. And we wanted to know specifically if you attended the last QI Learning Academy back in February, or if you watched the recording of that session, which was posted to the EPIC website, or if this is your first Learning Academy session. So we're going to launch a short poll. And if you could just take a minute to reply to that, that'll be really helpful. Just waiting for a few more to reply. I'll give you about 10 more seconds. All right. So it looks like the majority of you attended the first QI Learning Academy session back in February, and about 40% of you, this is your first learning session. So welcome to our new folks. Welcome back for those who joined in February. We're really happy to have all of you, and that's really helpful information. So if you didn't attend that first session and you'd like to go back and watch the recording, we will put the link to that in the chat box. Next slide, please. So just want to remind everyone of the goal of this Learning Academy. So the goal is to build grantee knowledge and develop grantee skills around quality improvement to support them in executing a QI project with an equity lens, achieve their programmatic goals, and meet the Healthy Start benchmarks. Next slide, please. So again, our first session was in February. Today is our second session, and we have 3 additional sessions every month through June. And all of these dates will be on the EPIC calendar, so you can check that calendar and register there.
So, Olivia, if I could just jump in,
Yep.
we're actually going to cover today, we're not going to cover data and equity. What we're going to work on instead are some of the power equalizing tools that we can use in improvement that we didn't get to on the previous call. And then I'll pick data back up in session 3.
Great. Thanks, Jane. All right, next slide, please. So here we go. Here are our learning objectives for this session. So the first is to surface untold stories that may inform improvement. The second is to use one or more QI tools. And the third is to identify the 3 questions in the model for improvement. Next slide, please. All right, now I'm happy to turn it over to Jane Taylor.
Thank you so much, Olivia. And will I have the ball, or I need to ask? I need to ask, right?
Yes.
Okay, next slide. So what we're doing here today is we're thinking about how do we ground our improvement work in equity so that it's really equity informed. And today we'll be talking mostly about improvement tools, and then we'll pick data up next time. Next slide. So before I get started, I'd just like to share with you this beautiful artwork, this map that was made by Marilee Namill, who is an American Indian artist who lives in Minnesota. And this is a map of the town where I live, St. Paul, Minnesota. This is actually Minneapolis, St. Paul. And this map notes for the Lakota people, Dakota people, and the Anishinaabe American Indians sites that are important to them, either sites where they have historical sites, sacred sites, and also naming the body of waters. And she also has depicted burial grounds, mounds as well. And I just fell in love with this when I saw it. So today I would like to give an acknowledgement of country. And I would like to acknowledge the traditional owners of the country or the land on which I stand today, that is the Lakota people of the Indian Nation, and recognize their continuing connection to land, waters, and culture. I pay my respects to their elders, past, present, and emerging, and to all Indigenous people from other tribal nations who may live in Minnesota and have made innumerable contributions to our region. I honor any of you today from tribal nations or who are American Indians that are on our call with us. Thank you. Next slide. So for those of you who were on the first call, I gave you some provocations to think about in the action period, which is what we call the time between these calls where you can apply what you've learned. And this can be open mic or it can be chat. But I'm wondering about what you would like to reflect back that you actually maybe thought about or had a chance to practice. For example, you might have had a chance to share the power map that we went over or even make one with some of your colleagues. You might have heard blaming language, which is an indication of a lack of equity and respect for cultural truths in the room. You might have actually even found yourself wanting to assert some blame. And last time on the call, we talked about how every system's perfectly designed to get the results it achieves, and that about 96% of the time we say in improvement when we're thinking about improvement science that if there's a problem, 96% of the time it's the design of the process we're working in and not the people. And so moving away from blame is part of the way that we infuse our work with equity. It's always been a part of improvement science, and we can hold that up as something that is a positive aspect of this work. And then I wondered, what did you observe in your work or your practice since the last workshop? And I'm just going to make space here. Yeah, Anaji, go ahead, please.
Yes, greetings, everyone. Nitakoya Oyase, all our relations, two-leggeds, the four-leggeds, those that swim, those that fly, those that crawl, all my relations. Thank you so much for having that land acknowledgement. And it's so, I think, so very important. What I've noticed between last session and this one is that there's an increasing number of conversations about equity. I just got off a call where philanthropy organizations are now speaking about reparations. So if we're speaking about equity, I don't think it's just a question of like what's going to happen going forward. I don't think we can really go forward without looking back and seeing how those who have resources acquired those resources, which is called unjust enrichment. So it's not just a question of white privilege, class privilege. It's really a legal question of unjust enrichment. So what I've noticed in the last month or so is this increasing um, wanting to get to the root of the problem and not just the effects of the problem.
Right, and really not just acknowledging it, but actually being willing to do something about it. And I have to give a shout out to Anaji because on the last call, he challenged me about the anti-social contract. And I'm reading Dr. Clyde's book on it right now, which is a great historical reflection that actually goes back to the Middle Ages, and talks about some of the legal ways that we have built our so-called social contract on as an anti-social contract. So thank you for that. I appreciate that so much.
No, it's my pleasure. He has a few books, but another book which he has, which is equally important, is called "The Black Minority: International Law and the Black Minority." So in the international law, there's something called a national minority that has rights to certain things because they preceded the establishment of the state. So it's called international law and the Black
Mm.
minority. And really, I think we're starting to say that even though we know we've talked about the 13 colonies from England, we really haven't connected how current policies are a continuation of that same thinking. So we're still in the process of decolonization. Uh,
Absolutely.
so social work in the social work field, there are different schools. I used to teach at Columbia, and we had started a course on that. So that more and more courses are starting to say, let's go deeper and let's look at the process of colonization and look at the process of decolonization. So if we're not involved with decolonization, by default, we're just continuing the things just the way they are.
That's right. Thank you.
Thank you.
How about others on the call? Did you find yourself, anybody get a chance to use the power map? I'm now building that into all of my work. I have a new project that is kicking off to try and build equity into primary care. And the very first thing we're going to do is look at that map with the funders and look at that map with what is our influence as the improvement leaders and innovation, provocateurs in that work. Did anybody get a chance to use it or think about it? Um, what about this idea of the blaming language?
Can you talk a little more about the blaming
Blaming
language
language?
changing?
Yeah, when things go wrong, usually we want to know who did that. And especially, I come out of a hospital background, so if there's some kind of a misadventure or some harm that's been done to a person that we're taking care of, usually we want to find out, well, who is the person that did that, and we want to punish them. And what we know from improvement science is that, or improvement work, is that leaders design the processes, most of the processes that we work in. And when something goes wrong, most of the time, it isn't because I screwed up, it's because this was not well designed. If you think about a recipe when you're cooking, if they leave out an ingredient and you don't put it in your food and the food tastes terrible, it's not your fault. It's because the process that you were following, the recipe, so to speak, uh, had a failure in it. So, one of the things that we try and do when we start practicing improvement is look at how our process is designed to function? And when they fail, what can we do to improve the process or the design of the work instead of blaming people? So it's actually it is a it is a it's good for people when they start doing improvement work because they can stop blaming each other, and it's one of the most profound transformative um, uh, outcomes of doing improvement work. So I don't know if you caught yourself wanting to blame or caught yourself being blamed, or maybe you can even think of a time when you were blamed for something that wasn't your fault. It was because that's the way the work was designed. Or if you think about COVID right now, and you think about some of the pressures your Healthy Starts are under around your data, because I've gotten a lot of asks for help around recruiting and retention. Uh, it's really it's because of the pandemic. It isn't because any particular agency isn't doing a good job. In fact, I think we're doing heroic work in light of everything that we're facing. Does that help?
It did, thank you. And it brought to mind, we recently did like a map of vaccine sites. I'm from South Phoenix Healthy Start. And it turned out that a lot of the vaccine sites were in wealthier neighborhoods rather than, excuse me, I'm recovering, rather than in neighborhoods like South Phoenix that are people of color and high rates of COVID. Um, so it felt like, who designed this, that they would put all the vaccines where it wasn't needed most, or vaccine sites where it wasn't needed most. So we found ourselves like blaming whoever designed it when we could be like, okay, this is what we're facing. How do we fix this kind of thing?
Well, and I think, Chicago did a great job of starting with the people who are most affected by COVID. So they actually went into the neighborhoods and took the exact opposite approach that most states are doing. They didn't go for people over 65 first. They went for, where do the people live and work who were most affected by COVID and had the most deaths and the most number of cases. And they've gotten a lot of call outs for that. And their mayor is just, Ken probably knows her, he knows everybody, just did an exceptional job, I think, managing that. Is there anybody from Chicago on the call? Ken, you want to jump in and reflect on that at all? You're on mute.
Yes, so I don't know the mayor
Oh.
of the mayor, but I don't. It's so funny, of the mayor, because of some work that a colleague has done, and they work with the mayor's office. So, but yeah, I don't know them. And I don't
Okay,
think we have anyone on the call either from Chicago.
from Chicago. We do have Healthy Starts from there in our.
Yes, we have
Okay.
several Healthy Starts are there in Chicago, actually 3, I believe.
Well, then let's go on to the next slide. And I want to tell y'all, for those of you who weren't on the first call, the improvement model that I actually favor is pretty simple. It doesn't mean it's not useful and that it isn't robust and that it doesn't have a lot of rigor in it, but I like it because it's just 3 questions I have to remember. And it's thinking about, what are we trying to accomplish every time we sit down to do something, every time we start an improvement project, or even when we're sitting down to have this time together today. How will we know if we make a change that things are really better? Because a lot of times they don't get better, they get worse. And so, how are some ways that we can ascertain that? And then the third question is, what changes can we actually make that will result in improvement? So, what will improve your recruitment and retention? What will attract more fathers into the fathers program? And then we take those ideas and suggest that instead of creating some grand scheme and some grand narrative, that we try these ideas out on a small scale. We think about what we want to do. We think about, how long do we want to do it for? How will we know that it works? What do we think is going to happen? And then we run it, we try it. We study what happened, look at what actually happened compared to what we thought would happen, and then ask ourselves, what do we think about this change? Is this change worth pursuing? Or is this a bad idea and we should just forget it? Or is it a promising idea and we just need to ratify it or modify it and put it back through another, what we call test of change. So when I'm talking about doing things on a small scale, I'm talking about maybe with 1 or 2 clients. Let's try something. So an example that I've used before, talking about this with Healthy Starts, is let's say you want to start really being transparent about the records you keep with your clients. And you've heard about sharing the record with them, letting them read it, and giving you feedback. And you do it for some reasons. One, make sure everything's accurate. And sometimes we actually make mistakes, and our clients can help point that out to us. So instead of deciding, okay, as of next week, we're going to have a new policy around here and we're going to do this with all our clients, what you might do is just try it with the very next client coming in, or the very next client you see on the phone. And you ask them, would you like to look at your record and see what we've been documenting about our visits? And just try it with one person. Make a prediction. How long will it take? Will they find some things to correct or any misunderstandings? Will it surface some referrals that maybe never got acted on, and some discussions around that? So you make some predictions about what's going to happen, and then you try it with one person one day and study what happened and decide what to do next. Okay, well, just because it works with one person, is it going to work with everybody? What about people that may be pre-literate or may not be facile enough to make sense of the medical record? Not the medical record, the documents that you keep. Or what about non-English speaking clients that you have? There's a lot of different kind of people that you serve. And so we don't want to always paint everyone with the same paintbrush. We want to make sure that we don't assume that what is good for the goose is good for the gander. We want to make sure that we can customize what we do, and we avoid these sort of grand implementation schemes that may or may not be useful, may or may not support people in what the areas where they need support. So this is the model that we use. And I think it's very handy, and I think it could be, when we look at it with an equity lens, we can actually improve on it. And on the last call, I talked about one thing we could do is be extremely specific. What are we trying to accomplish for whom? And here's an example of that. I don't know if y'all have heard of snowball surveys, but you talk to someone and ask them, who should you talk to? And then you ask them, who would they talk to? And when all of the referrals start sort of heading to one direction, that's a source of some pretty good subject matter knowledge. So I was doing a snowball inquiry around improvement and equity, and all of the roads kept leading me back to Multnomah County in Oregon. And you'd say, well, Oregon is a weird place for equity, because isn't it just kind of like northern Idaho? A lot of white people live in there, but it turns out it's pretty diverse because of farming and the viniculture there, especially Asian Hispanics populations. So I had conversation with the equity director in Multnomah County, and he said the advice that I would give to any of the people you work with who are starting improvement projects to make them more equity focused is to be very specific about the targeted group they want to work with. And of course, that brings up Dr. Power's work at UC Berkeley around targeted universalism. So I was thinking about this project I'm doing in California with the state of California with the Medicaid office. And it's to improve care for people who have asthma. And it could be any age group, 0 up to 64. And the group that I was working with in the Bay Area said, we want to focus on 150 Black men aged 22 to 38, because we can tell from our claims data that this group of men are struggling the most with medication management. They're having more exacerbations that are landing them in the emergency room than anyone else, because they stratified all of their data by race. So they didn't say we're going to improve care for asthma for everybody in the Bay Area. No, they said we're going to focus in not just on anybody but men in this particular age group, and see, can we make a difference in supporting their asthma self-management of their condition. So that's an example of being super specific in your aim statement, and really putting a stake in the ground for a few people who would benefit the most from what you're doing. And our assumption is, and what we've seen, is that if you can make an improvement with a small group of people who have been most affected by some inequity, that that improvement will translate to other groups, can be scaled up to others. And our I have to admit, in my world, we have done just the opposite for a million years. We're going to improve care for everybody, and all boats will rise. And it turns out that's really not how it works. So one of the best ways that you can start infusing equity is do the power mapping, the map of influence among all your stakeholders and the way data flows among your stakeholders and the people you serve. And then think really deeply about what you want to accomplish and let data guide you, or what you know about the people you work with. Because you know a lot about them, and you know really how to focus your efforts to help them. I'm working in Camden on a breastfeeding project, and what we're trying to do is identify women in the prenatal time period, because our theory is if we can work with them in the prenatal planning, or in their early natal period, that they will breastfeed longer and have more, their infants will get more breast milk. So that's an example of being super targeted in your aim statement. So what you missed last month was, what are we going to do? By when do we want to do it? For whom? And how much improvement do we expect to get as we do this? And I might tack onto that today. What would be the next group of people we would want to work with around this improvement? Next slide. So there are other models, and I will say some of you may have learned about these. There's Lean, which actually has its roots in the philosophy of quality improvement. There's something called Six Sigma, which is about reducing variation to very infinitesimal levels. If you live in New York, you might have heard of Focus PDSA or Focus PDCA. There's quality circles. There's about 10 different improvement models floating around, but I prefer the model for improvement because I always make a joke about my age and say, even in my extreme estrogen deprived state, I can remember 3 questions. And then everybody laughs, but it's really simple and incredibly robust. Next slide. So that was sort of my bringing you back to review of last month's work. Now we're going to go into breakout rooms, and we have 25 people on the call, and I have to ask Olivia, does this include, well, it doesn't, what I want to do is put 3 of you, get you in groups of 3 randomly, and you'll have 3 minutes each to tell an untold story. And what is an untold story that you have experienced in your community about trying to make improvements? And it doesn't have to be in Healthy Start. It could be any part of your community life. It could be a positive story, or it could be a negative story. And let me just take a moment to say why I'm sharing this. I was really profoundly influenced by the creator of the Equity Rider, which was first used by Pearl Street, a film company. And it's a rider that is put in the contract of by film companies, contracts that they make with other people around filmmaking, that require that 50% of the people that are hired to work on this film are people of color or LQBTG, right?
LGBTQIA
Thank you. Thank you, Ken.
plus. There you go.
I know. I can remember 3 questions, but I can't remember 5.
That's too many letters, so I got you.
But they on what I learned from the creator of this rider is that there are these truths that people of color experience, and these truths are the unspoken or the untold stories about their experiences. And that if we follow these untold stories, they are the route to justice. And justice plus love, as Martin Luther King, is action, great action. So I was thinking that you probably all have experienced some truths that have not been spoken before about your experiences around trying to make improvements. And I wanted to give you space to do that in small groups, because I think if we follow those threads of the stories that you surface, it will give us a direction that brings more equity into our work. So that's the rationale for this exercise. So I'm going to ask Olivia and Lisa to put you in rooms of 3. If you don't want to tell a story, you don't have to. But if you do have an untold story or truth, tell it to the people you're with. When you come back, anybody that wants to share can share, but it will not be. I won't call on anybody to share. I'll just ask if anybody wants to share an untold story.
Thanks,
So if you
Jane.
could, yes.
Yep, we're going to launch the breakout room. So you should see a screen or a box pop up on your screen asking you to click join. If that box doesn't appear, you can go down to the bottom toolbar. You'll see 4 boxes and breakout rooms. If you select that, you'll be able to join.
Welcome back, everyone. I took the slide down because I was thinking at this time after experience like that, it would be really nice to see everybody. So if you want to, and you can, this is a moment for us just to connect visually. And I have an important question for y'all. Was that enough time? I really didn't know how much time to make this. Should I have made it longer? Anybody? Lisa says it was enough time for us. What about others? Anybody else? Okay, thank you, Mary. Connecting with other sites is the, let's see, Lisa said, most rewarding part of this process. Yeah, so I'm going to try and design more of that in, Lisa, just so you know. Anybody want to share an untold truth that you didn't really maybe think was, or maybe you have thought it's connected to this work all along? Anybody have something they want to share? The reason I'm asking is as we at NicheQ deepen our approach to equity and improvement, I'm serious about Fanshin Cox and Yolanda Seeley Ruiz's challenge to follow these non-dominant narratives, like surface the non-dominant narratives around improvement, these missing voices and stories that we haven't heard yet, so that we can hear these untold truths that will inform justice for us and actually give us a path to do the equity work in the community. I think in ways that are not the dominant narrative. So what we're really trying to do here is overthrow the dominant stories that we've heard, tap into the abilities and skills and experience of the people that we work with and live with, and take advantage of those truths when we start doing improvement work in the community. And you are already doing improvement work with the clients, and as you start expanding your boundaries after COVID, or as COVID relents a little bit, you have a lot of influence. And I think these untold stories, this non-dominant narrative, is the best chance we have of creating a future that we all deserve to have. So if you'll give me the slides back, view back, Lisa, I will continue. So I had mentioned in the first workshop that there are some tools that I think are power level setting tools, and they are used in improvement work a lot. And so I wanted to share some of them with you. Um, and I'll just tell you a little story. When I was a young woman, I wasn't even 30 years old yet. I had graduated. Had graduated from graduate school and was working for a hospital corporation. They owned 250 hospitals and managed 250 hospitals around the country. It was predominantly a culture of young white Protestant men. And out of the 400 CEOs, there were only 11 of us who were women, and no people of color were CEOs of hospitals or even chief nursing officers. And the corporation had one African American person that worked for them, and that person was in human resources. So I was at a meeting, and I was used to being, because I was a woman, of course, never heard. And I went to my first quality training, and we did a brainstorming activity. And in a brainstorming activity, you go round robin, and every person in the circle gets to say what they think. And that gets written down. And then later, when you're considering options or you're considering ideas, every idea is considered no matter where it came from, because no one can, there'll be so many ideas. They're not attributed to any particular person. And it was the very first time that I ever thought that what I had to say was as valuable as what the CEO of the company said or anybody else in the room. And it was one of those critical moments for me. And when I was so attracted to the liberatory nature and the inclusiveness of some of these tools, and I'm sure I'm blind to the ways they don't do it, but I was like on the spot, I was interested, engaged, and wanted to pursue this. Little did I know it would become my life work. But one of the reasons that I'm so attracted to this work is because of how inclusive it can be um, when some of these tools are used. So the tools I want to go over today are ground rules are not my favorite tool, but I'm going to talk about group norms and agreements and ways that those can be used for learning and not good behavior. I want to talk about a meeting process that's basically a PDSA cycle. And then I want to go over some tools that I like because I think they're inclusive: brainstorming, nominal group technique, structured discussion using a talking stick, and a sociograph. So, first, let's talk about ground rules. Let's go to the next slide. Now, I'm a person that hates rules. And, oh, you can go back one then, back up, sorry. But a lot of times when you do improvement work, they'll say, well, the first thing we have to do as a team is we have to make a bunch of ground rules, and we have to agree on what we want to guide our behavior. And already I feel myself starting to rebel, right? But there are things like, oh, we want to start on time, we want to end on time. If we say we're going to do something between the meetings, we're going to do it. We're going to honor everybody. We won't interrupt. There's sort of these nice things that makes meetings go better. But actually, I'm a fan of this guy named Keegan who teaches adult development at Harvard, and he says that these kind of agreements that we make really have one purpose, and that is when we violate them, like we say, these are the agreements we're going to make together. And when they're violated, it isn't about blaming or who did that, but it is about trying to understand what are the contextual factors that would cause us to break our agreements, and what can we do about that. So they're really learning agreements, and it's not so much the agreement, but what can we learn when we violate the agreement, when we do start coming late, or when we do violate what we say our norms are. Our norms might be cultural humility. So what are the kind of contexts that would create us to violate that? So a lot of times teams will set up ground rules in the beginning. But then I do want to share with you the 7-step meeting process, because I found this like one of the best ways to have better meetings. Now advance me. Thanks. So this starts with the idea that, and this is a power sharing idea, that every role on a team, formal role, is rotated among the leaders of the team. So some of us are team members. One of us is a team leader today. Next week when we meet, it might be Denisha, and the next time it could be that we meet, it could be Chelsea or Kathy or Mary. But we're going to rotate those roles every time we meet. Um, Somebody's going to keep time, and that's also rotated every meeting. Someone is going to be the recorder, rotated, and you may use the facilitator, in which case that role is also rotated. So that way you don't have one person who's always leading the meeting, one recorder who's always in charge of what gets written down about the meeting and the decisions that got made. And the other thing about this meeting approach is that everything is done on a flip chart when the person is recording, so that there's complete transparency. And that flip chart document becomes your meeting minutes, and you review those before you leave the meeting. So I don't know about y'all, but I've been to a million meetings where when I come back and they read the minutes back out to us to approve them, I'm like, was I even there? I didn't know we agreed to this. So there can be many a slip between lip and cup between the recorder and the meeting leader after the meeting. And this takes that away. So we're going to review the meeting minutes before we leave and agree to it. And guess what we're going to do? We're going to plan our next agenda. So the group is in charge of the agenda, not the leader. And the group is following its own thread about what needs to happen next. So I'll show you how this looks structurally, and you're welcome to print this next slide up and use it and give this meeting approach a try. In fact, that'll be part of my ask of you at the end of the session today. Next slide. So these are the 7 steps. Why are we meeting today? And let's agree on that. Is this still the reason we're meeting today, or has something else come up that we need to do instead? So it's not review the purpose of the meeting, but let's just clarify why we're here and change it if we need to. Let's go over the roles so everybody knows who's keeping time today, who's recording, who's leading this meeting. Then let's review the agenda, and every agenda item has a time allotment to it. And as we review the agenda, that gives us a chance to change it based on whatever has happened or whatever we need to do. Then we actually start our meeting and we work through the agenda. The timekeeper helps us manage time. If we run out of time for a certain item, we talk about it as a group and decide what are we going to do. We don't just end the meeting or say, time's up, let's go on. All of these are power plays. So we're trying to mitigate power plays. Then the recorder is recording the meeting on a flip chart paper, and the team reviews that and reviews the decisions they've made and what their next steps are going to be. That's the 6th item. And they plan the agenda for the next time they meet. And then they say, how did we do today? What did we do well, and what do we want to do better next time we meet? In other words, the meeting is a process. The process can be improved, and we can improve it ourselves. So this is the way it goes. And a long time I kind of resented the fact that only one of the 7 steps did we actually do the work of the agenda. But what I found following this is that it can create a sense of ownership among the team members for what they're working on. And let me show you what the form looks like. Next slide that we developed that you can use. You put the date. I'm going to start annotating here just for a minute. So here's a place to record the date and the time of the meeting. When did we start and when did we finish? What's the team name? Where are we? And then the first thing we're going to do, we're going to clarify our objective. We're going to go through the roles. Today, this person is the recorder, leader, the timekeeper. And everybody's still okay with that? Check in. Then we review the agenda. and we work through the agenda items, which are listed right here on your form. When you're done, you review the meeting record on the flip chart. And what I used to do, because I'm kind of a lazy person, I never transcribed those meetings. I would just fold the flip chart paper up, put a 3-hole punch in it, and put it in my notebook with the meeting agenda on top of it. So there I had my meeting minutes already done. And then on the new piece of flip chart paper, we just follow this format and say who's going to record next time. What do we want to accomplish? Who's going to take on which one of these roles? And then what are the agenda items we want to work through next time we meet? Then after we've done that, is there any work that needs to happen in between? Any PDSA cycles that we need to do in between now and when we meet next time? Anybody we need to talk to in the community or meet with? And then what went well in the meeting? And you do all the did wells first, round robin. Each person gets to say what went well for them until there's nothing else left to say. And then what do we want to improve next time? And again, you go round robin in the room. You can pass if you want to, but we record this so that we can learn, are we getting better? Now, let me just ask, has anybody here had the opportunity to use the 7-step meeting process in the past? And please come off mute because I'm not looking at the chat. And well, then let me recommend it to you. I think it is refreshing for the leader not to always have to lead. It is really good development for everyone else to share that. This will help mitigate some power dynamics, and I would encourage you, print this slide out and just give it a go. Make your own PDSA cycle, make your own predictions about it. Talk to a couple of people in your organization to see if, or show it at your next meeting. Can we use this format? And have a go at it. Next slide. So that's one tool I wanted to cover today. Now, the third question in the model for improvement is, what changes can we make that will result in improvement? I do a lot of healthcare work, so we always look to evidence. What's an evidence-based change we could make? What do we know about maternal mortality? Okay, if women have doulas, they have better outcomes. So that's a change we can make around here. We can help connect women to doulas. If infants breastfeed, they get a better start on life. So what changes could we make around breastfeeding? There is plenty of evidence for you. But there's also times when your staff or your subject matter experts, they are the lived experience experts. And so are the women and fathers that you serve. And they have ideas, all of them, your staff and the people that you serve, mothers and fathers and grandparents, all people in your community, your big stakeholders, they have good ideas. Our job and improvement is to find out what these good ideas are. What are these non-dominant narratives that we haven't considered because they're not evidence-based? They're not in the dominant literature. It doesn't mean they're not a good idea. How do we capture these ideas? And the beautiful thing about PDSA is we can try them all out. If they're not going to harm the hair of a head of a person, we can make a hypothesis or a prediction, and we can try it on a small scale, and we're going to learn. And when in my experience, when staff get engaged and the people we serve get engaged in this kind of activity, when everybody sees that their idea counts, and not only counts but will get a fair test, we have seen turnover get reduced. So we've seen longevity increase, we've seen joy in work grow, and so it's actually a very liberatory process. So I want to talk about brainstorming, or you might have heard of it as blue skying. And what are some good brainstorming techniques that can make sure that all voices get heard, that contributions are made. But remember, the only people who can contribute are who are in the room with you. So you've got to constantly be thinking about equity when you have your meetings. Do we have women on our team? Do we have fathers on our team? Do we have, if we multi-generational work, do we have other generations on the team? Because it takes a lot of people to take care of kids. Do we have stakeholders here? So just thinking about how to be inclusive all the time. Maybe you have stakeholders that can't come to every single meeting, but they can come to some. So being thoughtful about that. Next slide. So let's talk about brainstorming for a second. I think that's what's coming up next. So brainstorming is a group tool. It's not a decision-making tool, it's an idea-generating tool to generate a lot of ideas among the team members or people with the lived experience or the worked experience. And so to do a good job of brainstorming, first you have to say, well, what are we going to brainstorm around today? And I'm going to propose to you, because we're going to do 2 brainstorming rounds, that we brainstorm around this. COVID is abating a little bit, so that as the pandemic, I'm going to type this in, fades some, we will start interacting more in the community. And excuse me while I type. How might we do that? So this is my provocation for us that I would like us to brainstorm on. But good brainstorming, I always review the tool first with the team, because it's easy sometimes to forget some important steps. So each person in the room, in turn, calls out, and you go round robin, an idea. And if you don't have an idea, you can pass, and each idea gets recorded on a flip chart. Well, we're not together in a room with a flip chart, but we have a virtual way we're going to do this. And we're going to build on and expand the ideas of others. So one of you might say, well, I'm going to recruit fathers at my local barbershop. And then someone else might say, oh, that's a great idea. That reminds me that there is a House of Prayer group, which is actually a band, playing in my community. I'm going to go there and reach out there. Or I'm in a House of Prayer music group. I'm going to go reach out there. So you can build on the ideas of each other. And as we do, that'll spur new ideas. No idea is a bad idea. All ideas are written down. You can be wild and crazy, because a wild and crazy idea might not work, but it could lead to something that will work. So we want to come up with crazy ideas. We do this rather quickly, and we're going to generate as long of an idea as we can, and we want to resist the temptation to stop when ideas slow down, because sometimes the best ideas come out in the end. Then when we're all done, we look at the list. And by the way, when we're brainstorming, you may not make a judgment about an idea. So if Stacy gives an idea, I can't say, well, that's the stupidest thing I've ever heard, because that will kill any future ideas. I have to just zip it and wait till we're done generating ideas. Or I can't go, oh, Kathy, good one. Or Lisa, that was a good one. I have to just not judge the ideas. Then when we're all done, some of the ideas might be really close. So I might have said, I want to go to my trombone House of Prayer group, and you might have said barbershop, and I'd say, well, they're the same thing. They're where men convene. But we can't combine or get rid of any idea unless the 2 people that generated those ideas, agree that they are the same and can be combined, or they agree that I agree, okay, my idea you're going to take care of it, so I don't need my idea. But again, we're trying to preserve the right of everyone who gave the idea to continue to keep it and not to have it erased. So that is how we brainstorm. So what I'm looking for now is a fishbowl. Next slide. And I want to lead a fishbowl activity with 5 of you, people who are willing to turn their cameras on. And raise your hand. I think there's a hand raising. Is there a hand raising function?
Yep, there is.
Okay, where is it?
Under reactions.
Okay, thank you. So if you're willing to volunteer, I'd like to demonstrate a quick brainstorming, And then we're going to go onto a Jamboard on Google and we can all play. And I need 5 volunteers. We're only 20 people, so 1 out of 4.
And if you can't find your hand raising symbol, you can always chat into the chat box.
So we won't do the Jamboard yet. First we're going to do the visual. So if you'll turn off the slide. And the topic will be, what ideas do you have about reconnecting with the community as the pandemic fades? And if any of you had to multitask and you're just coming back, I can explain the exercise again, no problem. Or your dog's been barking and you had to go put them outside, no problem. Mary, thank you. So Mary, if you'll turn your camera on, that'd be awesome. Lisa, thank you. Lisa, Mary. And you'll have to come off mute too. I need a couple more. I need at least one more person because 2 is not enough. What ideas do you have about reconnecting with the community as the pandemic fades? All right, Stacy, thank you. And if you'll all come off mute. So I'm going to ask Lisa to just record what you're saying on a piece of paper for us, and then she can, or in the chat, and then she can share that continuous chat with us when we're done. So
To
I'm just going to.
that's Lisa Hong from NicheQ.
Yeah, thank you. We have other Lisas. Okay. Stacy, what's one idea you have?
To reconnect with the community. One of our big outreach events before COVID and everything was health fairs. And we haven't gotten to do an in-person health fair in a long time, but I think there's a really good way to do maybe more of like a come and go healthcare situation, maybe drive through at this point.
Okay.
Something like that.
So come and go or drive through health fair, is that okay? Lisa? And you're on mute.
I'm thinking about some sort of announcement that we're returning to in-person services, and maybe even it'd be exciting if we could bring a small something to share with the family. I don't know what, a bib or something for the baby to kind of get people excited about seeing us in person again.
Okay. Mary?
Yeah, mine was similar as far as we expanded our office during this time too. So bringing people to the office and, giving them books or, diapers or something to kind of celebrate us all coming back together again.
And I'll add, we will go to a community meeting that already exists and bring some food and meet people there. Stacy, you got another one?
I would say, yeah, offering things is always a good idea. So whatever you can offer to clients and getting yourselves back out there, but also inviting, at least in our area, there's a lot of partners that are doing work with similar populations. So making an event where they can hear about more than just our services, but other services that are available to them as well.
Okay, Lisa?
Me again?
We're going to keep going around and around.
I'm going to cheat and share something. Ken just PM'd me that we could call our event "Welcome Back, Baby," and I thought that was real good. I'm getting excited. The wheels are turning. What could we do to really make people feel connected to us? That's not a new idea, but inexpensive.
Okay. Mary?
we're really trying to open up some community gardens. So maybe having like a community planting event, or sharing the harvest, or sharing seeds or something like that, bringing everybody to that location.
And I'm going to say go to the cultural groups that are already meeting, and bring some giveaways or food to that event. Stacy?
Oh man. I think whatever, this is kind of going along with what I said before, but whatever services we can offer as well. We have a lot of parents that had, one example is like car seats. We had a lot of questions about car seats that we haven't been addressing in the same way in the last year, because we haven't had the same kind of interaction with our clients. So something that's very tangible, that they can come get their car seats checked or get a new car seat or something like that.
All right. Lisa?
I'm struggling here.
You can pass.
You know what? I'm thinking too about our staff. So not only preparing the community, but making sure our staff have everything that they need to feel comfortable. And so what does that look like? And, you know, what guidelines do we need to document, and resources do we need to be sure they have? Of course, things like masks and sanitizer, whatever it looks like, but just making sure it's a comfortable and clear process. Probably, I imagine there's still going to be screening, like we're going to have to ask families still, have you had a fever? Have you been vaccinated? Maybe we haven't really gotten that far. So that would be the other angle to think about. Every family's excited, but getting staff totally prepared and comfortable as well.
Mary?
Yeah, I think bouncing off of that idea is really understanding families' comfortability with getting back together first and foremost. I think there will be a lot of people who, you know, delay it a long time, which is totally okay, versus those that are like ready to get out and get back together. So understanding what they need to do that.
And I'm going to build on the car seat idea and say we're going to join with the fire department, our local fire department, and have a car seat day. Stacy, got another one?
I think something around food, especially in the spring, or for those clients that have older children as well. I think it has to have a lot of different, I'm not offering anything concrete here, but I think it has to have a lot of different methods for people to be served and involved. Kind of like what Lisa was saying, some people are more ready than others for kind of that personal interaction. So just giving everybody lots of options.
All right, thank you. I just clicked, sorry, I looked at the message. Who was Lisa, was that you? Okay. Mary. You're on mute, Mary.
No, I'm thinking, I think I'll pass this around.
I'm going to take a different tack and say, I'm going to contact the FQHC down the street from me and ask them who's pregnant now, and or who's delivered since we spoke, that so that I could, or maybe I'm going to contact Medicaid and ask them who's had a baby since the pandemic started, and I'm going to start doing outreach. I'm making this up. I don't know if I can even do that, but it doesn't matter. Stacy? So we would keep going around and around until we totally ran out, and we would resist the now you're starting to slow down, but you have to resist the temptation to stop, because the best ideas could come out right now. And when someone gives a totally different or wild and crazy idea, like I'm going to go to Vital Statistics and get a list of every birth certificate and match it to my zip codes, and we're going to invite these people and have a big party, but a safe party. The crazier ideas you get, that it's perfectly okay. So thank you all for participating in the fishbowl. And let me just show you what we would do next and what we would do next, and then we're going to all get on Jamboard. So if we could go back to the slides. And I know it's excruciating to watch because you're not doing it, but thank you for watching. So next slide. So you end up with this big list of ideas. So I actually did this for Tracy Morris in Philadelphia with her team because they were trying to figure out some ideas for outreach. And another technique that you can use besides brainstorming, which extroverts love, but actually what will generate more ideas is to give people a quiet moment to list all of their ideas down on paper. And then you still go round robin, but they call out one idea at a time. And you can build on somebody's idea even if it wasn't on your original list. So it's the same process, but it just starts with a written list. And then it's important to say, well, and this is what happened with Tracy. We've got so many great ideas. And so, Lisa, you want to show us the ideas that were captured there in the chat? Okay, thank you. So we have all these ideas. Now, what are we going to do? I'm overwhelmed. Well, we need to decide on some criteria to vote these ideas down. And to first we'll look for any duplicates, exact duplicates, and then I would negotiate with whoever the two people were who had those ideas, if we can combine them or not. And then we would, if you'll go to the next slide, next slide. We have to figure out some way that we can, and I'm going to come back to these slides, but I'm trying to get to my multi-voting and rank ordering slides. Next. So we need to multi-vote. So usually the multi-voting rule is we say we've got, how many ideas are on here, Lisa? Can you count them for me? Yeah, Mary, I agree. I don't like popcorning because it empowers the people who are domineering and disempowers everyone else.
I believe there's 17, Jane.
So we would take 1/2 of 17, 8 and 8 is 16. So we'd take 8 ideas plus 1, 9 ideas. So we want to reduce our list to 9 ideas. And I'm kind of in the Lonnie Guinier school of voting, that you have 9 votes, but you could put them anywhere you want to. And you could put all of them on one point or equally distribute them, or if one thing is so meaningful to you, you want to put 4 dots on it, you can. But basically, if we were face to face and we would be doing this all together and we'd be having a lot of fun, you would take your 9 dots and you would distribute them on the chat items that Lisa put in the chat for us. And so we would pick our favorites. So I'm just going to ask, I'm just going to annotate for a minute. Who did I have? I had who was in the brainstorming? Sorry, I should have written it down.
Lisa, Mary, and Stacy.
Lisa, Mary, and Stacy. Lisa, what are your top 9 ideas? And you're on mute, but I'm going to violate my own principles and just for expediency, and I'm going to say you give 2 for that, 1 for that, or 2 for, oh, why am I disappearing? There we go. Oh, weird. So everyone would go up and you would stick your dots on your favorite items, and then we would count up which got the most votes. But the criteria, we have to set criteria for voting. Otherwise, we'll end up with a wide list of things we might not be able to do. So our criteria might be, what can we do that would be the safest? Or what can we do that would require the least staff? Or what could we do that would bring in the most number of people? But you set some criteria to vote. And you vote. So then we end up with maybe 4 or 5 ideas, and then we just have to order them in some kind of priority. So this was multi-voting, what we just did. And then on the next slide, it talks about a process called rank ordering, which is when you take your favorite ideas and rank order them. But another choice that you have is you may have a matrix like this, and you may decide that, what's super costly to do or what isn't. And then you might say, what do we think would have the biggest strongest recruitment possibilities? And what would maybe have less, and we would put the less over on this end. And we might take our ideas, ideas that we have. This is what I did with Tracy's folks, and they had to plot them. Or it could be ease instead of money, easy to do and hard to do. You can have any kind of things on this matrix that you want, but you just start arraying the ideas. If you have them on stickies, you put them on here, and then you see that you want to start with maybe the things that are easiest to do and are going to have the biggest impact. So we're going to work through this diagram in this fashion so that we start off with our biggest chances of success. So you could put it on a matrix if you want to. And now we'll go backwards, or in the slides if you don't mind. We talked about multi-voting. Go back. But basically what we're trying to do is make a group decision and use some of these tools to make a decision that gives as many people as we can the most voice. So there's some tips about group decision making. Balance, inquiry, and advocacy. Because if somebody advocates for ideas, sometimes the squeaky wheel gets the oil. Work to understand what is the rationale behind people's advocacy, and you can only do that by asking them. And ask other people why they voted for something or why they feel so strongly. And don't, we try and avoid majority rule because voting creates winners and losers. So that's why with this idea of multi-voting, I was saying you can put all your dots on one thing if you want to. And we're not getting rid of all the ideas. We're just going to pick a criteria and vote the ideas. Now we come back next week, we may use another, maybe we had our event and now we want to use another criteria. We're willing to look at things that might have a bigger impact or things that might be more geared for fathers. So we can use different criteria. It doesn't mean our ideas aren't good. And then start testing. Even if you have competing ideas, I think we should do this. No, I think we should do just the opposite. Well, okay. Can we try them both? We'll learn something. We don't have to decide whose baby's prettier. Let's try all ideas. And then explore how can you come to agreements about your voting criteria. And if you'll go back one more slide. So idea generating tools are great, but what they do is they generate a lot of options. They can generate creativity. They take advantage of the non-dominant experiences of people in the room. And if you do a good job of explaining it and running them, you can come up with a lot of great ideas. Test them, as many of them as you can, and you are empowering your staff or the people that you work with. And not only that, but ideas generate more ideas. So we call this will building, and execution is testing the ideas, and building will generate more will. Testing ideas will generate more ideas for the future. So then if you'll go forward and catch me up, I have a couple other tools I wanted to show you today. This is rank ordering, and this I'm going to just leave you with these slides. You'll have these, but once you have a big brainstorming list and you've voted 1/2 + 1 and you've got your key number of ideas, decide on some kind of criteria to rank your ideas on, and then you can rank them. And if you can only do 1 or 2 ideas, you just start with the first 2, and then later you can come back and work on the other ones. So this is just instructions on how to rank order, but if we were face to face, we'd go through all this, but it's really hard to handle virtually, but I still wanted to give you the tools because I think you can use them. Now let's go to the Jamboard and let's do an idea generation. And Lisa, you want to tell us how the Jamboard works?
Sure. I'm going to ask Olivia if you can post the Jamboard link to the chat box. That'd be helpful.
Will do.
Thank you. So once you get the Jamboard link in the chat box, you can open it up and you should be able to access the Jamboard. And I'll go through the different tools that you can use on the left navigation bar here. So there's a pen, there's an eraser, you can select different things, Post-its, you can post pictures, even build shapes, add a text box, and even use a laser. So first, the pen tool, you can use this, especially if you're on your phone or on a tablet. You can even do it on your computer, but your mouse is your pen essentially. And you can draw different things with your pen, and you can even write text if that's easier for you. It's a little difficult for me, as you can tell. So we'll go ahead and just clear that out by using the undo button here at the top. And okay, and then we'll step to the Post-its, because I think this will be most helpful for our brainstorming session. When you click the Post-it, you can go ahead and type your message, ideas that you want to share. You can even change the color of the Post-it to distinguish yourself. And once you click save, you'll see the message that popped up, and you can just keep posting your message, and it'll just keep generating different Post-its as you click save. And so you'll see it keeps generating that.
Oh, Lisa's saying that she's getting the message you need access.
Oh, let's see. Thank you, Lisa. I'll go ahead and try again, please. Go ahead and refresh your page. Thank you so much for that. Great, I see everybody's joined now. Great. So go ahead and feel free to test out using the Post-its. Again, you can even draw shapes. You can add a text box and start typing your ideas without the Post-its. And so this is kind of how you can use the Jamboard to brainstorm your ideas as Jane goes through a prompt for you all.
So let's brainstorm. Who has something you would like some help with? And we'll brainstorm around that. Who on the call can come off mute and share something you want? Like,
Okay, can you hear me now?
yes.
Okay. Well, we usually have an Easter egg celebration for our kids every year for Easter, but we can't this year due to COVID. So we've been having to kind of brainstorm what we could do different, you know, to still make it where our families can feel a part of the program and kind of get what we need from them, and they get something from us. We got donations to give them books in a basket, so that's really cool. But we can't, as I said, congregate. So we came up with doing the training on Zoom and just on how we're going to distribute the stuff that we want to give them. You know, it's too expensive to mail it. You know, the packages would be too big. We can't do that. So without, you know, it being a conflict.
Okay. So let's all brainstorm for her and just start on your Post-it notes and crazy ideas. It doesn't even have to be okay. It doesn't have to be realistic. Y'all putting ideas in? Is this working for you? Do you see how to find it? This is the best we can do. I know that y'all struggle with the virtual world, just like I do. And I'm actually trying to create an experience for us that would approximate if we were in a conference room together doing this.
Some of the ideas are posted on page 1.
Ah, there you go. There you go. I'll just go ahead and remove these.
Okay, we got a lot of good ideas. So what we would do, and you can keep brainstorming, is we would look for any virtual, any exact duplicates, like virtual Easter egg hunt on Zoom, and I had virtual Easter egg hunt on YouTube. And to me, those are different because the Easter egg hunt would be you'd have to go on YouTube and find these little things. So I would say I wouldn't want to combine those ideas. But maybe I would have given in and said, yeah, that's the same. Let's just call it virtual Easter egg hunt. But we would start looking for exact duplicates. And then we would maybe take one of those matrix and say, well, what is doable with our resources, and what do we think families would enjoy more? Or we could say, what could we do without expending too many resources? You can decide anything you want to for your decision making. Now, as long as we're here, there is another tool, and I think we can all move these around. Yeah, we can. So there's another tool called an affinity diagram, where people start silently arranging ideas that they have, that they see kind of go together. Like I might put these two ideas together, and I might pull this one over here, digital scavenger hunt. But you might have a different opinion, and somebody grab one of those three that I just put together and move it to where you think virtual Easter egg hunt might go, right? So we do this silently, and we continue to make new affinities or relationships and group things together until we're done. But we can't talk about it. And the reason we don't talk about it is I have to sit back here and go, wow, what does the Easter Bunny giving out baskets to family, how is that like the Easter Bunny in the neighborhood? Why isn't that more like over here? And so then we have whoever had Easter Bunny in the park or moved this. So you just keep moving it, looking at these different relationships, because it forces us to consider thinking about things in a new way. Then when we're all done, we're going to come in here and say, okay, what do we call this group? What is this? And what do we want to name this? And these become categories of our work. And then we can keep all the ideas, and we can have captains or people, volunteer to lead these different groups. So maybe Jose is going to lead this one, and Yulia is going to lead this one, and different people volunteer to kind of take on some of the testing or making these ideas manifest. So this is called an affinity diagram. Questions about this, and if you're on the phone and you can't see what we're doing, I apologize. I live for the day when we are together and we could actually replicate this, and I hope there will be a day like that soon. Questions or comments or objections? Experiences using these tools? Yeah, the only thing tricky with Post-it notes, Lisa, is sometimes you have to tape them down because they have a way of falling off. Okay, I think I'm going to go back now to my presentation and kind of bring us home on these tools.
Oh, okay.
So
Thank you for that. Those were some great ideas.
Oh, you're welcome, Yolanda, and thank you for volunteering to problem solve with you or generate idea generation. So today we reviewed the model for improvement, the 3 questions. What are we trying to accomplish? I am advocating that you be as narrow as you can when you pick your projects you want to work on, that you really think about the people you serve and who you want to target. How will we know a change is an improvement is all about data. I'll talk about that next Academy. What are the changes we want to make to bring about improvement? How do we tap into the non-dominant lived experiences of the people we work with and the people we serve? How do we honor the local expertise that exists and take, use it and really remain humble about it? How do we actually get these truth surface as a path to justice and equity? And how can we think about the ways that we meet using the 7-step meeting process and some of these group tools to mitigate power? And how can we also remain vigilant and observant about power? How can we rotate leadership roles and other meeting roles to mitigate power? And I have another tool that I would like to share with you if I could have a whiteboard or a blank slide. I'm sorry to pull this on you, Lisa. If you could just make me a blank slide, I want to draw on one tool. It's called a sociogram. And I like this tool a lot, and I've used it a lot. And what you do is you draw the people who are sitting around a table in a meeting, and you put their initials next to where they're sitting in the room. And you draw a line between the person who is speaking that represents the length of time of their speech and the person they're directing their speech towards. So I'll show you what this looks like. So I have a table of people. And this is Jane, and this is Lisa, and this is Olivia, and this is Ken, and this is Anaje over here, and this is Stacy, this is Yolanda, and this is Denisha. This is how we're sitting around the table. And so little Miss Blabbermouth over here, she talks a long time. And then she has several side conversations over here. And Olivia doesn't talk very long. But now she started directing everything she says over here to Yolanda. And even though she's not, Yolanda is the only person that she talks to. And then let's say Yolanda is talking mostly to Denisha, having side conversations, and some with Stacy. And some she addresses the group. But somebody in this room is a big hog of the airspace. Now, you'll notice that Ken never said anything, Najee never said anything, and Stacy didn't, and Lisa didn't. So what I do during a meeting, especially if I have dominating personality on my team. So in my world, that's usually a physician. And they're just running roughshod over everybody. Nobody else gets any airtime. But in your world, I don't know who it is. But one thing that I like to do is take this drawing, and at the end of a meeting or at the middle of the meeting, just put it down on the table in front of the room, in front of everybody, and say, what can we do about this? Are there any tools that we could use that could help make the contributions more even? Because we know, for example, that Ken has a lot to offer, and the fact that he hasn't said anything means that our team might not be considering options we should. So I talk about the possible effect of not hearing from everybody. I don't say it's definitely the effect, but I say one possible effect is we hear all the ideas from this person, but there are a lot of good ideas that the team might not consider. What do you want to do about that? And then the team then I have to be quiet and listen to what the team says. You can take the slide down. This is called a sociograph, and I found it very helpful because a lot of times the person with that domineering voice they're not even aware they're doing it. They're such habitual talkers, they're not aware of it. And so this makes that, again, it's another chance to show the power that is going on in the potential influence that may not be useful for a group. So now if you'll go back to my slides for me. And so the team might say, well, let's use a talking stick as a way to manage this. So has anybody in the room used a talking stick? Really? Okay. Well, a talking stick, you just pick up some object in the room. It doesn't have to be a stick, but it's said to be a Native American tradition. I've never done the homework on that, so I don't know. But you have the stick, and as long as I'm holding the stick, I can talk. But when I hand it over to the next person sitting next to me, which might be Wesley, then Wesley takes the stick, and Wesley can talk uninterrupted as long as he wants to while he has that stick. And then he hands it off to Monica. And none of us can talk again because we've already talked until that stick has gone all the way around. That is an example of another tool that you can use, a talking stick. It's also very effective. There are some other tools. One is called structured discussion, and I know I have a slide on structured discussion. And structured discussion is we're trying to make a decision about something. We generated all these ideas, and we're down to like 2 or 3. Which one should we choose? Each person at the table says, well, I think we should use ABC. I think we should have Easter egg hunts in the park. And I say that because I know that people will be outside. There's much less risk outside to COVID. Families may feel more comfortable coming to the park. And then I stop, and Wesley's sitting next to me, and he says, Wesley, what would you say if you're still with us? Come off mute for a sec. Or Monica, are you here, still here? What might you say? Melanie?
Are you asking me?
Yeah, I am. Thanks.
Oh.
What would you say on one of the Easter egg things we just did? What would be your what are you going to
I like the one in the park with the bunny. The
Okay.
bunny passing out the eggs at the park.
All right, great. Yocasta, are you with us?
I am, yes.
What do you like? And
I
why?
actually like the baskets, giving out the baskets out to the families with the Easter Bunny. That could be done at the park or maybe at a central location.
Okay, great. So everybody at the table would go along just like we did. And one of us would summarize points of agreement. We all like the Easter Bunny. There's 3 of us have said in the park is okay, is good or okay. And yet there's still the idea that we might want to have the Easter Bunny go out to the homes where people are that we serve. And so we would just keep continuing to go around. Each person gets to say their point and why. We summarize what we agree on and what we disagree on, and then we can discuss it as a group and interact with each other. And then we have one more round of what we think and why. And usually by that time, it makes it much easier to make a decision. So that is how that works. It's a technique called structured discussion. You can give that a try as well. I think these are all the tools I wanted to do today. We just talked about the affinity diagram, which is arranging ideas. Questions and answers, things you want to comment on, objections, your favorite tools.
I'd just like to apologize. I was trying to find my mic.
Oh,
I think everything I would just say, I agree with what everybody's saying. It's social distancing and it's a good idea.
oh, great. So now we have even more agreement in our structured discussion. So thank you, Wesley. I'm sorry about that, putting you on the spot and making you hunt for that button. Thanks. Other questions, answers, other favorite tools that you've used?
Jane Wesley was like one of the kids potentially searching for that egg at the Easter egg hunt. So he was actually hunting for the button. So he was practicing, right, Wes?
I'm happy I found the egg.
Yeah, I am too.
And you made Yolanda smile because that's why she organized it, right, Yolanda?
Yeah, yeah. But I also like to, Miss Taylor, what you said about not realizing that, you know, a person who's more dominant, and I like the stick of saying everybody being able to say something. And like you said, we don't have all the ideas because Ken didn't speak. And so you have something to contribute, definitely. Everybody has something that they can contribute. The more ideas, the better. I like that, making sure that, you know, each person contributes, you know, or have something to say, because we all have great ideas.
That's
I
exactly
like that.
right. And how do we tap into those non-dominant ideas and get them out? And Wesley, I'm glad that happened because with the mute button, because I could have sat here and gone right to blame, like nobody on the call wants to come off mute. I haven't done a good job. They're not interested in what I'm doing, when it was a systems problem. So I could already start that blame talk when really the system problem is the button is obscure. Oh, maybe I'm colorblind. I can't even see the red button. My brother's colorblind. He couldn't see that. Um, so a lot of times we uh, just looking at what is it about the process that makes it hard to come off mute and talk, instead of, oh, they don't want to talk, and being frustrated. So I think is this idea of not blaming is so, can create so much liberation, and especially with staff, if they don't, because when staff feel blamed, they feel beaten, and so do clients. We have habits of blaming people who don't have as many resources as we do. I mean, white people do. I know we do, and it's not useful. There are other better ways of being in this world.
Jane, if I can just quickly say, just again, with Healthy Start in its 30-year history, and again, being around since the beginning, and I'm only 32, by the way, people don't think I'm so old, but in the early stages, when Healthy Start was a demonstration program, one of the reasons why they started the design of Healthy Start is to be community-based, community-driven, because what they were hearing from women and families, the challenges to getting to those visits. So again, back in the day when there was the blame game where the hospital staff said, oh, they don't care about these appointments, they're not coming, they're coming late, they didn't respect my time. They had no idea that clients were taking 2 buses to get to your appointment. They had to take care of another kid before they got, so they were unaware of really what was going on. But in the early days of Healthy Start, I remember that was a conversation all the time, really understanding really what's going on before you start that negative narrative. So that's really been a big change over these decades, where people are really trying to understand before, as you say, really going to that blame or going to that story. So it's amazing to hear it now 30 years later, because that's all that the talk was in the early days of Healthy Start, because people just had so much to say about these clients that didn't care about their babies, and that's, this, that, and the other. So I just wanted to mention that for folks too, but it's good to hear.
It's a great history. I love being reminded of the very founding principles of Healthy Start, because the more we can call that forward, I think the better for our future.
And I would say with this Zoom, it's a challenging the way that we have to communicate now. So it's the same story, but just the what we have to do has changed. And I've learned to embrace a challenge. I love a challenge now. So it's working. It's just working it out to me.
Thank you.
To just piggyback a little bit with what Ken said, and given the history, Healthy Start has eliminated so many barriers. Those were barriers that the families had, and we couldn't believe some of the barriers. They were unbelievable, some of the barriers. And so not only did those barriers get exposed on what was causing the patients and clients not to make it to doctor's appointments, or missing so many appointments, or doing different things, but the barriers became exposed, and Healthy Start has eliminated so many of them. That's really great.
Awesome. And that's why it's such a shame in this pandemic. It's just such a disruptor. Um, anything else y'all want to surface about today? All right, let's
Well,
carry on.
Jane, just
Yeah.
again, just 20 seconds here, but I think that's also, it's exciting that we actually are doing what we're doing right now in this moment around looking at, quality improvement. Because again, this, as Wesley was saying, as Jelana was saying, this need to be adaptable to what's happening. And again, Healthy Start is back where it started. We have to be innovative. And so how are we going to do, continue to do what we do? So I think it's great that people have an opportunity to be in this academy to kind of get down and nitty gritty and really understanding it better, because we need it now more than ever, right? Because of the times that we're living in. So that's one of the good things I think out of this, that is pushing us to go back to that innovation that we started with. So just wanted to mention that for our group too, because that's why this academy I think is so important.
Thank you. Awesome. Next slide then. Homework, what? Things to think about. Denisha, you're up.
Thank you, Jane. Thank you for sharing, and thank you all for sharing and really participating. This has been really great. So yes, let's get right into the homework and next steps. Next slide, please. So I'm actually going to pass it right back over to Jane to just explain the homework and to challenge you all to try a few of these steps.
So action learning, that means you learn by doing. Some things that you could do. You could try that 7-step meeting process. You could start asking over and over again, like a broken record, what is it we're trying to do, and for whom are we trying to do this? Like if we're thinking about that Easter egg hunt, exactly what do we, or the Easter eggs or the books, exactly what is it we're trying to do, and who do we most need to reach? And then generate some change ideas with your staff. Try a brainstorming session, affinity, a jam board. I don't know how that was magic for me, but I'm sure that Lisa can share how she did it. Use a matrix and put on that matrix some of the ideas that matter to your agency, to your Healthy Start, to help make decisions if you have a lot of ideas. Ask a client about an untold truth or an untold story that they have. Because if that really is the route to these untold stories, this non-dominant narrative is the route to our future, a more just and equitable way, the more stories we hear that guide us through it, I think the more likely we are to create that better world that we all deserve, to dream that world together and then use QI to make it happen. So what's coming up next time is testing changes and looking at data. And we might even spend 2 sessions on that, depending on how it goes. But thank you all so much for your time today. And I appreciate your feedback. That helps me a lot. I will design a couple of more interactive sessions for next time, and give me some feedback on how long they should be, because I don't want to have death by breakouts, but I also want to give you enough time to connect.
Thank you, Jane. Lisa, you can go ahead to the next slide. And we want to continue to encourage you all to connect with your fellow Learning Academy participants and Jane on Colab. If you do not have a Colab account, or if you're having trouble accessing your account, please feel free to email us at healthystartnhq.org. Next slide, please. Just as a reminder, our next QI Learning Academy session is Thursday, April 16th, so about a month away, same time, Eastern Standard Time. Next slide. These slides will be available to you, but these are just a overview of the deadlines and events that are coming up in March. I can't believe we're already mid-March, but all throughout March. On the next slide, we have our survey. So if you could just take a quick minute to either scan this QR code with your phone, and to do that, you just open up the camera function. Yes, it is a Friday. Thank you for confirming, Chelsea. Open up your camera function on your phone and just hover right over that code, and a link should pop up in your notification bar, and you can click there for the survey. Just as Jane said, we'd love to hear from you. We'd love to see how these academies are going, how we can better them for you all. So please take the time for that, and we'll make sure to put in that link right into the chat.
Okay, great. I was just going to ask for that too.
No problem. Thank you, Lisa. Next slide. And again, we encourage you, if you have any questions, to please email either us at Healthy Start NHQ or Jane Taylor, and her email is right there for you all to get in contact with her. Again, you can also contact Jane on CoLab. Next slide. And again, big thank you for joining us today, and we are looking forward to our next Academy.